I'm Julie Bartke with Session Update. Jerry Kerber, Inspector General at the Minnesota Department of Human Services, appeared before a key Senate committee today to outline steps the state can take to reduce infant deaths at child care centers. Now, according to Kerber, 65 of the 83 infant deaths over the past decade were due to unsafe sleeping arrangements. Here's his testimony from earlier today.
Of the 83 children who died in family child care, 75% of them were found to be in an unsafe sleep condition related to that death. 75%. So 65 of the 83 deaths that occurred were in an unsafe sleep arrangement. I don't want anybody to get the impression that there's necessarily a widespread problem in family child care. There isn't. Most of the people we heard from, parents we heard from, said that they just love their family child care provider, and it's the most wonderful thing in their lives. They consider them to be an extension of their families, and they're very warm, nurturing environments. And so this is not to be construed that there's something categorically wrong with family child care. All licenses for child care in Minnesota are issued by the state. They're issued by the Department of Human Services. There generally are two types. There's family child care and there's child care centers. Family child care licensing monitoring activities are completed by counties. And there's about 150 county employees out there who do that monitoring activity. They process applications, they do site visits, they investigate complaints. But if there's a need for a licensing sanction of any sort, they make a recommendation to the department, and then we seek to employ statewide standards, and then we issue those licensing sanctions. That's different than the child care center arrangement, where those licenses are issued by the state again, but the monitoring activities is done by state employees in our office. So we need to, one of the first things that we have in our proposals is making it more clear what these expectations are for providers. And so that starts with us doing a better job of training our own staff. We used to do training, the state used to do training of new county licensing staff, but again, with budget reductions over time, we had cut that out. But that was a mistake. So we're proposing to reinstate that. We're also proposing to modify the training that's available to child care providers, to update it. We heard a lot about how it's antiquated. We want to update it and improve it for the content, and also make it more available around the state. One of the things that we know about when these deaths occur, there's not been a case where a provider hasn't known what he or she was supposed to be doing. They didn't do what they were supposed to be doing for some other reason, and so it's the quality of that training needs to really help people understand how it's so very, very, very important that they do this and why.
It's very interesting because I had someone this week who had been given an award for being a child care provider, got sanctioned for violating safe sleep, and she showed me the monthly form that she fills out for her crib environment, and it says no mattress pads can exceed 1 inch, but she got violated for having a mattress. She got the violation for having a mattress pad under the sheet, and the statute is unclear. And so I'm going to ask you, please, as you make all these changes, have outside reviews, make sure that forms match statutes. She's been doing this for 15 years. It's the first time she's ever had a violation, and she was in tears because she doesn't ever want to put a child at risk, and now it looks to the world like she has.
Those are exactly the kind of stories that we've been hearing about, and you will see some language that's clarifying what the expectations are for portable cribs. And portable cribs are sort of their own unique kind of challenge, and it might not be in the budget bill, but there's also a licensing bill that seeks some clarity there. But it's those kinds of things that we need to make sure we have sort of internal consistency and then statewide consistency.
The Senate Health and Human Services Finance Division is expected to hear from child care providers later this week.